Well, good afternoon, everybody. Can I just check this microphone is working? People can hear me at the back. Great. Okay, listen, I'm just going to do some housekeeping remarks for those of us here in the room, and then in about 2 or 3 minutes' time, we're then going to go global, as it were. So the housekeeping is phones. Please put them on silent, but don't turn them off, because we'd like you to tweet. And of course, the other thing is you're more than welcome to take photographs, but please don't stand up, and please don't use flash. And the reason for that is the television cameras at the back don't want a picture of the back of your head standing up taking photographs. But you're more than welcome to take photographs, as I can see some people are already doing so. The loos are downstairs. You may well have found them, but anyway, that's where they are. If there's a fire alarm, I gather there is a delay mechanism and we should wait here and we will be advised what to do should there be a fire. We have got a very tight timetable. We're going to be shifting, as I'll go through the program in a moment, we're going to be shifting from one place to another around the world. We're going to get people beaming in, we hope. That means, sadly, there isn't any time for us to take any questions or have comments from the audience, so we'll be talking at you, or groups of people will be talking at you. But there will be plenty of time at the end, and indeed I saw there was plenty of time to start off with as well for discussions. And we're all very keen to hear from you, the organisers and so on. Final bit of housekeeping is that when Her Royal Highness arrives, which will be during the last panel, you don't stand up, we carry on. The only people who will stand up will be Mary Watkins, who will be on the stage, and we'll welcome her, and 2 or 3 of us here who will be sitting next to where she is sitting. She will come and she will listen. So you don't stand up at that stage. But what you do is later on, when she is leaving, that's the point at which I think you stand up. Okay, that's my understanding of the protocol. Okay, that's the domestic housekeeping. I'm going to wait for a signal from the back to know when we will be going live globally. So, Simon, are we ready for that yet, or? Yes? Right. Well, my name is Nigel Crisp, and it's my great pleasure to welcome you here in London, but also to everyone who's listening around the world, to the launch of Nursing Now. And I do so on behalf of my co-chairs, Professor Sheila Tlau, who's in Geneva, and you'll hear from her later on, and Mary Watkins, who's here, and you'll hear from her later on as well, but also from the entire campaign board, many of whom are in this room or in other rooms linked to this room around the world. And can I say this is really global? There are 16 countries on the board. 2/3 of the people on the board, can I say, are nurses, and 1/3 are non-nurses, and 2/3 are women, and 1/3 are men. Just to say those are the sort of proportions we think are right, because this is a nursing campaign, but it's actually about those of us who are not nurses also saying it's time to pay more attention to what nurses can do. Because this is a global campaign about raising the profile and status of nurses so that we can improve health globally. And it's based on a terribly simple premise. Nurses and midwives make up half the professional health workforce globally. That's 20 million people. And we simply can't achieve universal health coverage without them. They reach everywhere. They support community health workers in the most rural parts of the world. They work in every facility. I don't know how many there are here in St. Thomas's Hospital. They provide continuity of care. And indeed, and this is a very important point, nurses' roles are becoming ever more important. They were always important, but ever more important as disease changes and we see more non-communicable diseases and long-term conditions, which require a different approach in many ways. They require a much more holistic and person-centered care, and that's, of course, what nurses do. So nurses have an even bigger role in the future, and that's what this campaign is about. Now, our wonderful program manager, Catherine Hannaway, is going to talk to you a bit more about the program in a moment. A bit more about the campaign in a moment. But let me just introduce the program that we've got in front of us for the next hour and a half or so. I'm going to just take a moment to welcome some people from around the world, and they'll come up on these screens. After that, as I say, Catherine will be taking 10 minutes just to talk you through the campaign. We've then got the first of 2 panels, which is about, the first one is people from 5 different countries, I think, talking about strengthening nursing around the globe and what it means for them in their countries. We're then going to go to Geneva. And in Geneva, we've got another distinguished group, as in this room here, where Professor Sheila Clow, my co-chair, will be chairing, and she will introduce to us Princess Muna of Jordan, who will be speaking to us, and also Dr. Tedros, the Director General of the World Health Organization, who is a great supporter of this campaign, and one or two other colleagues. We will then come back here, where we will have a panel chaired by Mary Watkins and a number of people who will, including, may I say, the new Chief Nursing Officer of the World Health Organization, Elizabeth Ero. And then we will have Her Royal Highness, the Duchess of Cambridge, who is announcing today that she will be the patron of the campaign. So she will... Great. So she's not just launching it for us, she's going to be staying with us. And I know that you'll be interested to hear what she has to say when she comes and joins us. So I said this was truly global. I also said I need to keep to time. So at this point, I would just say that we have got people watching from, I know, at least 30 countries, and that there are events going on now in Jamaica, in Uganda, Singapore, I think, Canada, the USA, Jordan and South Africa, as well as many other places. So greetings to everyone who is listening and watching this through the live streaming arrangement. But I'm hoping that we're about to see 3 of those groups. And that what we're going to do, and I'm told this is the right order that I should be taking them in, I hope this is how they're briefed as well, is we're going to go first of all to the USA, where somebody is going to talk to us. Please come in, USA. Is that Barbara? Hello, USA. Early morning. Have we lost the volume?
Yeah, oh, can you hear me?
We can hear you now.
Okay, good. Good morning from North Carolina. We're very thrilled to be here. We've got a lot of people from all over the US, and we're delighted to be hosting this.
Great. And Barbara, what does Nursing Now mean to you and your colleagues?
We think it's a great opportunity to look at nursing today and where we are right now, not to bring things from the past, things we've all done, but to look at where we're going and what we can contribute to universal health care. And that's what we're very excited about here in the US.
And I know that you in the US are also keen to work with your colleagues in other countries about this as part of a global movement.
Indeed, we are, yes. And that's why it's being hosted from IntraHealth International, which is a non-profit based here in the US, we work with health workers all around the world. And we're very proud to have joined with UNC, School of Nursing, University of North Carolina, School of Nursing, to have this launch here. And going forward, we hope to look at how we can align the things that we all do in nursing to make sure our reach is global.
Thank you so much, Barbara. We're going to stop there and we're going to move from the west to the east, going the opposite way to the sun, I guess, and we're going to go to Jordan and welcome everybody whom we can see in Jordan. Welcome, Jordan.
Hello. Thank you, Your Lordship, Lord Nigel Crisp. Ladies and gentlemen, greetings from Jordan and from King Abdullah University Hospital, with the convening of all nursing leaders in Jordan here. We are honored to take part in this international campaign, Nursing Now. We are privileged in Jordan to have Her Royal Highness Princess Muna Al Hussein, the founder and the president of the Jordanian Nursing Council and the WHO patron of nursing and midwifery in the Eastern Mediterranean region, for her leadership role in advancing health and welfare in Jordan and globally, and for her continuous support to nurses, and for being an advocate for programs that support the Sustainable Development Goals and strengthening the health workforce to achieve universal health coverage. We believe that nurses play a crucial role in healthcare system in Jordan as elsewhere. Therefore, we focus our strategies and efforts to empower them in multidimensional approach, including decision-making, infrastructure and work environment, recognition, access to information and technology, and lifelong learning. Thank you all for this opportunity and partnership in this campaign and for taking part in this live stream event.
Thank you very much indeed. And I don't know if you could hear that, but that was applause from the room in London as well. So thank you very much indeed. And then finally at this moment, at the starting moment, we're actually going to go to Durban, where we have a group from right the southern tip of Africa. Hello, Durban. Would somebody like to say a few words to us?
Ethiopia, Lesotho, Malawi, Swaziland, Uganda, Zambia, and nurse leaders from the University of Natal School of Nursing and Public Health. As a second Vice President of ICN Board, I am honored to join these nurses and ICN TB Project Director for the launch of the Nursing Now. Nurses in Africa are watching and actively working hard to support the goals of this campaign. Today, we are places at the heart of tackling the 21st century health challenges. Today, we are visible, vocal, and valued. We are a voice to lead. Thank you.
Thank you very much. And you may like to know that you are being applauded all around the world. That doesn't often happen, so absolutely fantastic. Well, look, you can see this is global, and those three countries are just representatives of the movement that is starting to be generated here. Now, I just want to say just a few words actually about the organisation and a few words of thank you before I hand over to Catherine. So first of all, Nursing Now, I'm delighted to say, is run in collaboration with the International Council of Nurses and the World Health Organization, the two great representative bodies, if you like, that we are linked in with. And we're very grateful to them and to our many partners that are listed on the website. I'm going to particularly note some of them. I'd like to note the Royal College of Nursing here, who provided us with offices. I'd note THET, who have provided us with the means to employ our staff. Health Education England, who've supported us. WISH, which is the World Innovation Summit on Health, are supporting a piece of research that we're doing on universal health coverage. Later in the autumn, we hope that we will be producing a good piece of research on how nurses can play a major role in achieving health for all around the world, and delighted that we've got the support of our friends and colleagues at WISH for that. And thank you for Guy's and St. Thomas's Trust for everything you have been doing here to make this work, including this technology, which you can imagine I was a bit worried about. And thank you to the All-Party Parliamentary Group on Global Health, of which the report, a number of members are here, of which the report Triple Impact, this was based on. Let me also thank in that context Jane Salvage personally, who supported us as our advisor during that and helped me in writing that report. So we're delighted that Jane's with us. And let me mention the 2017 cohort of the ICN's Global Nursing Policy Leadership Institute, run by Jane and by Jill White. And you'll see some of their comments about that programme displayed down where we had lunch. So I hope you were able to see that. But above all, in organisational terms, I want to thank one organisation, which is the Burdett Trust for Nursing. You'll have seen on our posters out there that we are actually a programme of the Burdett Trust for Nursing. I have to tell you that Mary Watkins and I went and talked to the trustees in the summer, and they backed an idea. So, you know, it was terrific. We came to you with an idea, and you backed us, you gave us the initial funding, you gave us the support, and you allowed us to be part of your organisation and rest under your your organisational arrangements. So we're really delighted and very grateful to you indeed. So, and then finally, let me just say thank you to a few people who've made this happen. You'll have seen we have a very small staff when you look at the website. We're running this on a shoestring, and we're all running quite hard to make it happen. Let me thank my colleagues, Joanna Rihar, Charlotte Refsum, Nick Payne, and also the team of communications who've been helping us here, Melanie Archer, John Butler, Helen Palmer, and Sagal Ali. But above all, there are three people who've made this happen. One is Catherine Hanaway, whom you will meet, who's been working since the summer, full-time or more than full-time, I guess, Catherine, on making this happen. She's our project manager. Second one is Sarah Klein, who hasn't been working with us quite that long, but she's handled all our communications and shaped up a campaign brilliantly for us. And then thirdly, I want to thank Gavin Tiffin and his team here at Guy's and St. Thomas's. Thank you all very much, and thank you indeed to my colleagues, Mary Watkins, as I've already mentioned, and to my other colleagues from the board. So that's enough, I think, about the organisation. Let's go straight on, and I think on time, to the next section, which is to welcome Catherine Hanaway to the stage. She is a nurse, so she's talking from the heart as a nurse as well, and she will be talking about the campaign itself before we then move on to our first panel session and then into the rest of the programme. Thank you all very much.
Thank you very much, Lord Crisp. Hello, my name's Catherine Hanaway, and as Lord Crisp has said, I'm the Global Campaign Project Manager, and how exciting it is for me to be standing up here, a real privilege to be able to tell you more detail about the campaign and how you can be involved too. So I trained as a nurse, midwife and health visitor, and actually qualified as a registered nurse exactly 38 years ago this week. I worked at the General Infirmary at Leeds, and when I became a nurse, it was a very proud day for me and my family, as it is for me to be standing here. It's been a fantastic opportunity as a nurse working with Lord Crisp, Baroness Watkins, Dame Christine Beasley and all the Burdett Trust Nursing, the campaign board members and our wonderful, dedicated, small team at Nursing Now. And as Lord Crisp said, I've been doing that for over 9 months now, getting ready for what the future holds for the 3-year campaign. We have global ambassadors, not only here, in Geneva, all over the world. And of course, today we will have with us our new royal patron, Her Royal Highness, the Duchess of Cambridge, all of them shining a light with us and for us on this very timely and important global issue. Achieving the vision for the campaign is a step process, and it can only be brought about over time. There's no quick fix, but we need to drive it with a sense of urgency. A leader's mood is contagious. This needs to be done by influencing policymakers at global and country levels and supporting the nurses everywhere in every nursing role at every level to lead, to learn, and together as part of a health and care system to build a global movement for change. So Nursing Now is being launched as a 3-year campaign, but there will be much more to come once that is done. As Nigel has said, Nursing Now has a truly global campaign board made up of its 21 members, but with that broad reach across 16 countries and covering all 6 regional areas of the world. We have on our campaign board 2 fantastic young novice board members. As full board members, we have Sarah from Canada and we have Menashe from Zimbabwe. Both are fantastic ambassadors for the young student and novice nurses across the globe. In 2020, nurses will celebrate worldwide the 200th anniversary of Florence Nightingale's birth. and there will be a World Health Organization report on the state of the world's nursing. Together, we will provide more evidence for policy and decision makers on where nursing can have the greatest impact. So I'm going to outline the 5 key areas that the campaign will cover and tell you in brief what the campaign will do and what you can begin to do by joining the campaign. Firstly, the campaign will advocate with and on behalf of nurses and nursing to maximise nursing's contribution to achieving health for all. The changing health needs of the 21st century means that nurses have an even greater role to play in the future, with new and innovative types of service needed, community and home-based, holistic and people-centred services, including more attention to mental health and well-being. And there must be an increase in prevention and making better use of technology by nurses. Secondly, the campaign will advocate for greater investment in more nurses, improving education, professional development, standards, regulation, and employment conditions for nurses across the globe. Countries around the world face huge challenges providing healthcare to their people because of the scarce resources, the rise in the burden of disease, an ageing population, and emerging factors such as climate change and migration. Nursing Now will encourage health leaders to invest in nursing and introduce those new models of care, advocating strongly to progress towards eliminating the global estimated shortfall of nurses and midwives of 9 million by 2030. Thirdly, the campaign will help to empower nurses to use their knowledge and skills and expertise to their full potential. In many countries in the world, we've heard from nurses that they could and they want to do more. We've seen wonderful examples of nurse specialists, nurse practitioners, of nurses and midwives working autonomously to the limit of their professional training and taking far more responsibility as team workers, including organising the supervision of healthcare workers and others. Fourthly, the campaign will support and encourage nurses to develop innovative practices, becoming even more involved in leading on the planning and delivering of treatment, of health promotion and of disease prevention, particularly in primary and community care settings, where often they are the person, the healthcare worker, closest to patients and communities. Fifthly, the campaign will advocate for more nurses in senior leadership positions, giving far greater involvement and influence for nurses and midwives on global and national health policy. We will advocate for at least 75% of all countries across the world to have a chief nurse or a chief government nurse as part of their most senior management team in health, and that these very senior nurses will be skilled, mentored and supported to play key roles in ensuring that all policies on health and healthcare acknowledge the role of nursing and nurses in their plans. As a campaign, we'll work with our partners to advocate for and support the development of more nurses in leadership positions, and we'll work together with the International Council of Nurses to create a network of very senior nurses to support our new Chief Nursing Officer at the World Health Organization, Elizabeth Iro. We'll encourage and support nurses to organise at their own country level, regional and global levels, and we've already begun to offer through our partners free access to nurses and midwives everywhere in the world, improvement and leadership learning through the USA's Institute for Healthcare Improvements Open School and the UK's NHS School for Change Agents. We'll help nurses everywhere to get better education and training through improved standards and regulation, in particular through sharing effective practice between countries. And we'll support nurses to develop and share research and evidence on the impact of nursing. We're already working with the World Innovation Summit for Health and the National University for Singapore. The Aga Khan University in Nairobi will shortly publish a study on nursing as a route to women's empowerment, and a study on economic and social impact of nursing is being developed by Harvard, and that will be published in 2020. We're encouraging everyone to share stories of effective nursing practice through storytelling, case studies, networking, and so on. Already we've got some wonderful examples of innovative practice on our website, with 2 government-level country-wide initiatives demonstrating progress in 2 very different countries, in Uganda and in Singapore. 2 hospital-level initiatives, Narayana Health in India and the Albert Einstein Hospital in São Paulo in Brazil. And 3 fantastic community initiatives from Jamaica, Rwanda and the USA. Through links with our partners and collaborators, in particular the International Council of Nurses, there are many great examples that we can all share and learn from across the globe. So our call to action today, as we launch this most important, timely campaign, is for you all to get involved. Nurses and midwives everywhere, healthcare partners and supporters, and of course, patients and communities. By sharing with us your experiences and ideas, we can all teach, and we must all be ready to learn. By you all becoming agents for change in nursing, we ask you to organise at every level of the system as advocates for the nursing profession. And we ask you to look on our website and sign our pledge to Nursing Now. That means everyone taking personal responsibility for raising awareness of the Nursing Now campaign in support of nurses everywhere. I know that many of you are likely to have linked to our website and our social media. For those who aren't, then here are the details. Do tweet now. You can share your plans, submit to us your case studies, sign the pledge, and generally get signed up to be part of this important initiative. So we hope, wherever you are in the world, whatever your role, we ask you to take action and to give the Nursing Now global campaign your full support. Thank you. Thank you. It's my great privilege to lead us on into the next session, and I'm going to invite our chair for the next session, Dr. Karen Bureau, who is a board member of the International Council of Nurses, and also Karen is the second vice president of the Norwegian Nurses Association. And perhaps, Karen, we could invite up the rest of your panel. Thank you. And,
please be seated, ladies. So, thank you so much, Catherine, for this invigorating rundown of the Nursing Now Global campaign. Very exciting. Gives me goosebumps, really, to think about what's going to happen. And I'm really very honored and privileged to be invited to chair this panel that will focus on what the Nursing Now campaign will mean for nurses and nursing in different parts of the world. We've invited 4 distinguished guests to join us here in the panel, and I would just like to introduce them briefly. On my left, our first panelist is Harriet Baldwin, who is a member of Parliament here in London, and she is also Minister of State for Africa at the Foreign and Commonwealth Office and Minister of State for International Development. Welcome. Second, we have Ms. Rosemary Josie, and she is the past president of the Bahamian Nurses Association. Welcome. And then we have Catherine Odeki, and she is the chief nurse and commissioner of nursing and midwifery in Uganda. Welcome. Our fourth panelist is Dr. Kanyana Shuntai. She is Director and Government Chief Nursing and Midwifery Officer of Thailand. Welcome to you. So, starting with you, Harriet Baldwin, how is UK Aid supporting nurses and nursing around the world?
Well, thank you so much for inviting me to be part of this panel today, and I'm absolutely honoured to be with you in a location which is so historic for nursing in the UK, but also from a personal level where I gave birth to my son. So it's really where I appreciate my midwifery and nursing at a personal level. But yes, I'm very proud of the key role and the acknowledgement of the importance of nursing that we've always put at the forefront of the work that we do through our budget in terms of international development. Because you're absolutely right to be highlighting in this campaign the fact that if you can invest in nursing and nurse leadership, the impact that that has in terms of multiplying the effect in terms of projects around the world. And so it's always been something that we've really put at the heart of the development work that we do. Just this year alone, we will be spending some £1 billion in terms of the UK aid contribution to health programmes on a bilateral level. And of course, we're also a very significant funder of the World Health Organization. And in the UK, we are really proud of the fact that there are so many children who get through to their 5th birthday, so many mothers who are able to have a successful delivery, so many inoculations that are delivered thanks to UK aid. But more specifically, in terms of some of the nursing projects, we do a lot of work where we are engaging with the leadership and the training and being able to therefore multiply the impact of that contribution. And I can cite specific examples of where we've done that in many, many countries around the world. And it's really why today I'm delighted to be able to announce that we are contributing £5 million to the Nursing Now initiative.
Thank you.
Thank you.
Wow, that is an amazing announcement. And it really is inspiring, and you could hear from the applause from the audience that we are very happy to hear this announcement, and especially for the support that the UK does give to our colleagues in developing countries around the world. So thank you so much for this announcement. And I think we'll move on now, in the interest of time, to the Bahamas, to Rosemary Josie. What does the Nursing Now campaign mean for nurses and nursing in the Bahamas?
Thank you for your kind invitation. In 2015, the government of the Bahamas has made a commitment to reviewing avenues to guarantee universal health coverage to all citizens that is feasible and sustainable across the health care. The Bahamas recognize that central to achieving universal health care coverage and tackling non-communicable diseases, our president, Ms. Paulette Cash, in collaboration with our director of nursing, Mrs. Marcel Johnson, and other healthcare professionals, to advise the government of the Bahamas on the best strategies for promoting and protecting the health of the Bahamian population. There's a growing burden of non-communicable diseases in the Bahamas that is putting an increased strain on our healthcare system. At the policy level, our directors of nursing and our nursing services and advisors help to ensure that the views of the professional bodies are made known to the implementation of process of the National Health Insurance as the Bahamas seek to advance universal healthcare coverage. At the national level, the Healthy Bahamas Coalition serves as the National Non-Communicable Disease Commission for the Bahamas. And as a member of that team, I look forward to introducing this group of dynamic, committed professionals to Nursing Now Global Campaign to help raise the profile and status of nurses. Additionally, we are in a unique position to to have the triple impact of contributing to the 3 Sustainable Development Goals, and that is of improving health, promoting gender equity, and economic development. There is an investment of our government, especially in the area of recruitment and retention. There are plans of great investment in the nursing workforce in the Bahamas in education, professional development, standard, and regulation. And as I close, in the Bahamas, one will discover a group of dynamic healthcare professionals, and that is nurses who often feel undervalued and underutilized in the sense of not being able to work to their full extent of their capability and training. However, they are resilient, they are innovative, they are passionate, and they are effective, right, in influence decision-making in global and national health policies. The nurses of the Bahamas look forward to advancing the purpose of the Nursing Now Global campaign in the Americas and indeed throughout the world. My aim is to work towards leadership development and mentorship of our emerging young nurse leaders and ambassadors throughout the Americas, and to increase the visibility of nursing across the globe by encouraging student nurses and practicing nurses to promote research evidence that will become essential for decision-making and effective practice. Thank you.
Hear, hear, and thank you very much for giving us a glimpse of what nurses in the Bahamas are dealing with and how they really plan to change in their practice in the future in order to gear up to meet the needs of the population. Thank you so much. Let's move on now to Africa, to Catherine Odeki. How are nurses and midwives in Uganda doing, and what will the Nursing Now campaign mean for them?
Thank you very much. In Uganda, this has come at the right time when nurses and midwives in Uganda needed it, this kind, more than ever. It's a platform that they are going to use to maximize their contribution to achieving universal healthcare coverage. And being frontline providers of healthcare, it's also going to be the re-energizing power to them as healthcare providers with a voice and a purpose to achieve. The Nursing Now National Interim Committee was put in place to analyze the documents of nursing and midwifery, and the committee identified 3 key thematic areas. The 4th one, cutting across, that's leadership and governance. And these 3 key thematic areas that they came up with are the ones that they looked at as the great potential of strengthening and transforming nursing and midwifery services in the country. The 3 thematic areas that they came up with were regulation, education, and practice. In each of these, many gaps were identified, but I'll just mention a few of them. In regulation, they looked at the area of expediting the approval and implementation of key nursing documents. And these documents were documents like the Nursing and Midwifery Scope of Practice, the Nursing and Midwifery Policy, the Nursing and Midwifery Cadre Schemes of Service, and to review the old Nurses and Midwives Act, which the one which is being used now is that one of 1996. In education, they looked at the area of training and training change champions and practice improvement teams. This will be the ones which will really lift the standard of nursing and midwifery in the country. To create a center of nursing and midwifery research and innovation, because today when we talk of evidence-based nursing, research is the one which can bring that out. To mentor nurses and midwives in research and publication skills, because many nurses do research but it's kept in the drawer, but now we want this to be published. And then also to start a research journal so that what nurses are really doing can be known globally by other nurses and other health workers. develop policies, standards, and guidelines for nursing and midwifery education, right from lower levels up to higher institutions of learning. And then, looking at nursing and midwifery practice, there are a few areas that I can mention that they came up with is articulating clearly areas of change and change agenda in nursing and midwifery. Reorienting all nurses and midwives on the concept of quality patient care and client care. And then developing and establishing programs that will allow nurses and midwives to have autonomy in specialized areas. Thank you very much. And
Thank you.
I hadn't concluded. I was going to say, and come 22nd March, we shall be launching Nursing Now in Uganda.
Very good. That's wonderful to hear, and thank you for telling us a little bit about the developments that are going on now in nursing in Uganda. It's really exciting to hear about. And I do hope that the Nursing Now initiative will give you some of the energy to help empower the nurses of Uganda.
Yeah.
Thank you. Let's move on to Thailand now, to Dr. Chun Thai. And if you could just tell us, what will Nursing Now mean for nurses and midwives in Thailand?
The Nursing Now campaign urged Thai nurses to realize their capability to make a big change in the healthcare system that need leadership for change. Thailand had implemented the National Universal Health Coverage Scheme since 2002, and the Universal Health Coverage Policy is successful in enhancing health equity and accessibility as well as financial effectiveness. However, there are some problems that need to be addressed, particularly those affecting nurse personnel, such as increased workload, nursing workforce shortage, and remunerable inequity. Healthcare facilities under the Ministry of Public Health are major healthcare providers in the country, and the reform of the health services system was initiated in 2014, using the concept of the 6 building blocks and decentralized health management mechanism. The country healthcare system has been classified into 12 health regions based on the population and health resources to provide seamless services. In this connection, the Bureau of Nursing plays a role as a policy level in establishing nurse officer networks to enhance linkage and strengthen leadership among all nursing on CNO network in all 12 health regions across the country. The CNO network in each region is classified into 3 levels: regional, provincial, and district levels. Therefore, nursing workforce development is planned in all 12 health regions across to the 20-year National Health Strategy. Moreover, to strengthening nursing and midwifery in Asian countries, Thailand was the host to lead the first meeting of government chief nurse and midwifery officer of Asian countries from 16 to 18 December 2014 in Bangkok, Thailand. And the country is planning to hold the second meeting to introduce the Nursing Now concept among nurses in Asian regions. To build a regional network of nurses champion and to advocate the assignment of more nurses in leadership positions. We believe that the powerful energy and dynamism of nurses drive health system. The resilience from the Nursing Now Thailand campaign will be applicable for all nurses and midwives across the Asian and WHO Southeast Asia region of all roles and levels to have the skill they need. Thank you.
Thank you so much, Dr. Shuntai. And Catherine Hanaway spoke to one of the goals of the Nursing Now campaign is that 75% of countries around the world will have a chief nurse and midwifery officer. We have just heard from 3 chief nursing officers from 3 different countries. Ladies and gentlemen, 3 voices to lead the nursing profession into the future and to lead the Nursing Now initiative. And also, we've heard from political leadership, and this is exactly the kind of political leadership that we're looking for to bring forward the message of Nursing Now. Thank you, panelists, for contributing here today. Thank you very much. Thank you very much.
Thank you very much, Karen. That was absolutely fantastic. 2 of our campaign board members there representing nursing across the globe, and other very influential nurses there, and thank you, Minister. So we're going to watch now a short video, and then I'm going to hopefully link us into Geneva. So thank you. Wow, wasn't that fantastic? Hashtag proud to be a nurse. Thank you to our communications team who have interviewed people, who have put all of those together. Many of you will know some of the names that you'll recognise on there. We've many more, and we want to hear from you all about what do you think about nursing and nursing now, nursing for the future. So we're going to move on and link up with Geneva. You'll know that in Geneva there is a launch going, and we have a panel waiting for us there in Geneva. So I'm not sure if they can hear us yet. I want to say, hello, Geneva, can you hear me?
We can hear you.
Hello, Geneva, and welcome to Professor Sheila Clow. She is our co-chair with Lord Nigel Crisp, and she's hosting this part of the meeting in Geneva. Welcome, Geneva.
Thank you very much. Thank you very much. We'll be handing over to you in the next, 30 or less minutes. But yes, hashtag nursing now, hashtag proud to be a nurse. I have already introduced our panel, so that at this particular juncture, I'm going to be calling Mr. Bertrand Levra, Director General of the University Hospital of Geneva, to really to welcome us and to give us his perspective from a hospital environment.
Thank you very much. Dear Dr. Tedros Adhanom Ghebreyesus, Your Royal Highness, Princess Munal Hussain, dear Professor Cairns, dear Mr. Vice President of the Geneva State Council, dear Mr. Poggia, first of all, I would like to express my sincere recognition for choosing our institution, Geneva University Hospital, as the host of this very important event, the launching of the Nursing Now campaign. Dr. Tedros, as well, please accept again my congratulations for your election as the Director General of the World Health Organization. This wish I can formulate is to not only contribute here in Geneva, but to further strengthen our collaboration from Geneva, an international city, to go all the way to the rest of the world. Considering health challenge in the 21st century, the main message I would like to express is that nursing appears to be a key component of the solution. Improving health globally involves raising the status and profile of nursing, as well as the empowerment of nurses on a clinical standpoint and on a decision-making process standpoint. During the last decades, nursing has changed in many ways. The current global paradigm pushes nurses to do more in less time, especially within the healthcare system. Currently, it exposes us to a shortage of nurses. In Switzerland, for instance, about 50% of nurses leave their occupation prematurely, and the 2,500 new graduates each year cover only half of the national needs. The consequences that follows is that competent and compassionate care is compromised, and therefore patients might suffer. The Geneva University Hospital management is committed to engaging resources to continuous improvement in care and training. We are committed to providing ethical care, which means that furthermore, we are committed to achieving those goals through intra and inter-professional collaboration, networking nationally and internationally. Contributing in nursing empowerment is one of the priorities to be considered if we want to impact positively the universal health coverage. Eventually, these improvements would make health access for all possible. On this day, this very particular day, I would like to deeply thank all of those people, all of the nurses, all of the professional staff which are around me here in Geneva, but all around the world, to thank them for the precious commitment of their work. I would like to sincerely thank you, Dr. Tedros, Your Royal Highness, Princess Munal Hussain, and Professor Kearns for joining in the significant initiative which many of us are proud, very proud to be part of. I wish you not only all the best, but I'm really looking forward to our fruitful collaboration in the years to come.
Merci beaucoup, Mr. Bertrand. Yes. Your Royal Highness, Princess Muna Al Hussein of Jordan, our very own patron, please share with us your wise words on nursing now.
Thank you, Sheila. I don't know that they're wise words, but I'm very pleased to be with you all today for the launch of this global campaign. As some of you will know, nursing and midwifery is a topic that I have championed throughout my life, and it is close to my heart. In my first year of marriage, I saw the need to train more health workers to improve the health of the Jordanian people. In 1962, I was approached by the Army with their proposal to initiate the establishment of the very first Army School of Nursing in the Arab world, which was then named after me. Since then, I have seen many dedicated and committed young students become high-level professionals, making significant contributions to strengthening the Jordanian system. Later, I helped to establish the Jordanian Nursing Council, the nursing regulatory body for nursing, which was established to anchor the nursing profession within the Jordanian health system. It was not an easy job, especially at a time when the voice of nurses was not heard. Following decades of hard work, one can say that Jordan sets an example for advancing the nursing profession and for giving nurses a prominent role at the policy level to improve our health system's performance. Nowadays, this council has a strong position at policy-making levels and has established strong partnerships with prominent nursing and health institutions, especially with the WHO and the ICM. Together with these core partners and nursing experts and leaders, we continue to work on ensuring that nursing has a voice in policy development and in high-level decision-making. I strongly believe that the role of nurses and the decisions that they have to make many times on their own or within a team makes a vital difference in reaching optimum health outcomes. It is only through a truly inclusive global voice and vision that the future of nursing can be established. To that end, it is my immense privilege and pleasure to launch the 2016 Global Strategic Directions for Strengthening Nursing and Midwifery 2016-2020. This document sets a robust and ambitious approach to guide nursing and midwifery development worldwide. 2 years ago, I was honored to serve as a commissioner in the High-Level Commission on Health, Employment and Economic Growth. The Commission has 10 recommendations and concluded that investing in health employment leads to better health and to inclusive economic growth. One of the Commission's recommendations addressed the issue of gender. The health and social sector is a feminized workforce. Expanding health workforce investment creates massive economic empowerment and opportunities for women towards the achievement of gender equal policies. Let us also not forget the opportunity available to create work for the younger generation. I am honored to be part of the Nursing Now campaign that captures the recommendations of the Commission, with particular emphasis on nursing workforce. Ladies and gentlemen, we cannot make progress on universal health coverage or sustainable development goals without having motivated, competent health workers. With this equation, we need to recognize the central and leading role of nurses, the largest health profession in the world. I am particularly pleased to see that the nursing workforce is gaining a stronger voice. Our presence here today signals a message of political commitment at the highest level. I greatly appreciate the value and dedicated efforts of the campaign members, in particular its co-chairs, Lord Nigel Crisp and Professor Sheila Tlaib. In advocating for empowering nurses and strengthening nursing development. I would like to reassure all nurses, who are my personal heroes, of my personal commitment to continue to support and enhance the nursing profession and improve global health. Thank you again, ladies and gentlemen, for your support for this agenda. Thank you.
Shukran. Thank you, Princess Muna. And I was there when you launched the strategy for nursing and midwifery, and it's my Bible. I live by it. So now we're going to turn over to our mother body, the International Council of Nurses, and we'll have Professor Thomas Cairns, who is the interim Chief Executive Officer, to really look at the role of ICN and why it is important that nursing now is calling on the wider health profession to back nurses to tackle the health challenges of the 21st century. So, we're with you.
Thank you very much, Chair. Your Royal Highness, distinguished guests, colleagues. It is a great honour for me to be here. I'm very humbled and I'm very privileged to be here as the interim Chief Executive Officer for the International Council of Nurses, an organisation that is spread across 130 countries with 133 representative nursing associations and critically representing the voices of 20 million nurses worldwide. I am a nurse and I'm indeed proud to be a nurse. We work very closely with international organisations such as the World Health Organization and indeed governments and many other international organisations to ensure that the voice of nurses and the voice of nursing is heard at a global level. And with the recent appointment, Dr. Tedros, of Ms. Elizabeth Iro as your new Chief Nursing Officer at the WHO and the launch of this wonderful campaign here today, we as ICN finally believe that the world is listening to those very eloquent expressions that you have just said, Your Royal Highness. We have maintained from the very start a fundamental strategic and operational relationship with Nursing Now campaign, and I'm delighted to say that today sees all of that hard work coming to fruition at this important multinational launch. I said I'm proud to be a nurse and I'm proud of my profession, and had a wonderful experience in meeting some of your colleagues from the nursing departments here in the hospital. And I want to thank them for giving me to this day a real shot in the arm, because what they demonstrated to me was the fundamental role that clinicians in clinical practice have, not only in informing the research that drives our practice, but critically shaping policy and education as well. There is no other profession, in my opinion, that attends to people's fundamental needs at their most vulnerable time as nursing does. The relationship between the person as a patient or a client or a service user and the nurse provides a unique and intimate view of the person's life. More than any other health professional and more than any other health specialty, nurses spend more time with patients and their families and have first-hand knowledge and experience of the human stories that have an impact on the health and well-being of patients, of us, of society. Everyone has a story, and every story has the potential to improve the health system and enable individuals, families and communities to achieve the highest attainable standard of health possible. And from these insights comes the power of change. In my opinion, the future of nursing depends on each and every one of us, unidisciplinary, interdisciplinary, service providers, service managers, recognizing the full potential of nurses and the nursing profession, to share our stories and evidence and to act upon our determination to lead through professional excellence at every level within global healthcare. And the launch of Nursing Now will provide, in my opinion, a much-needed boost to steer nursing towards a future where we work with leaders at every level, nationally, regionally, and globally. Nursing Now aims to improve health globally by raising the profile and status of nursing worldwide and nurses worldwide, and therefore influencing policymakers and supporting us as nurses to lead and to learn and build a global movement. And ICN could not be any prouder than working with this organisation. I'm finally going to tell you that we are also honoured as an organisation today to launch our IND kit, which is Nurses, a Voice to Lead, Health as a Human Right. And I think if achieving the Sustainable Development Goals and universal access is critical, then nurses are the vehicle through which we can achieve this. Thank you.
Great. Thank you very much. All right. And now, to my home countrymen, Director General of WHO, Dr. Tedros Adhanom. Now, we are depending on you to really tell us. We know you've done a lot of things, including appointing the chief nursing officer right there. So inspire us on the role of nurses in the WHO.
First of all, I'm proud to be part of this Nursing Now campaign. Really proud, and the proudest moment. And thank you to the General Teaching Hospital of Geneva for hosting us. And also thank you, Your Royal Highness, Mona, for your commitment. We had a meeting before we started this launching conference, and we have agreed one thing with Her Royal Highness. This campaign is not a one-day event. It's a daily activity, and I take that to heart. So we're starting it today, launching it, but it's a daily.
I think you don't have here. Ça doit marcher, mais.
Ouais, on doit juste reprendre à votre temps.
We have a problem of connection with London?
Yes.
Okay.
Hello, Sheila. Can you hear me?
Mr. Tedros.
Okay.
Can Sheila hear me? Sheila,
Sheila can hear you.
Hello,
Yes, Sheila can hear you.
Keep going. We're enjoying the conversation. Dr. Tedros, thank you. Please continue.
Yes. So he can continue. Agreed.
Yes.
Continue.
Okay.
Thank you, London.
So, London, I was saying how proud I am to be part of this Nursing Now campaign. It's the proudest moment for me, because I know how nursing is important from my own experience, and a force that we should reckon with for WHO to be successful. And I was saying about my meeting with Her Royal Highness Muna earlier today, and just want to share with you what we have agreed. This launching is not a one-day event. It's going to be a daily activity, daily business. And we have to prepare for even more things to come. So I really take that to heart, and thank you so much, Your Royal Highness, for that. And I would like to thank Her Royal Highness, the Duchess of Cambridge, for joining us and for your support. And I know you know full well about nursing, the importance of nursing and midwifery, because you're the mother of almost 3 kids now. And then to my brother, Nigel Crisp, during my campaign for the Director General position, he came and asked me, will you appoint a nursing officer? Or are you going to have a structure for nursing in WHO? And I said yes. We didn't even argue. I don't know if he was convinced, but later on, after I became DG, he came back to remind me.
Yes.
And I told him there is no need for reminding, I will do it. It's because I said I believe in it. And that's why we have Elizabeth Airo as Chief Nursing Officer. And the reason for that is, when I was Health Minister in Ethiopia, we wanted to increase the role of nurses, because nursing is not about just care only. They're bridges with our communities, with our families. They're teachers, they're leaders, they're innovators, and we wanted to use their full potential. And we wanted to involve them in HIV care management. And some partners came and said to us, no way, they cannot do it. Then we said, yes way, you will see it. And we went ahead with our plan. And they were trained on HIV management, and they saved many, many lives. So now, for universal health coverage, we have it documented actually how their role is very important. They're the front line, they're close to the community. And for universal health coverage, using that force, mobilizing that force is very important. I don't think we will achieve the SDG goals or UHC without nurses. And that's why, from the start, we said
no universal health coverage without nurses. And that's honest and true, because it's the biggest force in our system. And without deploying the biggest force consciously and rationally, you cannot win, because outcomes depend on how you deploy the biggest force you have. So that's why WHO believes in nurses, and that's why we say no universal health coverage without nurses, and we will do our best to really reckon with this force and to make our goals, UHC and SDGs, happen. And maybe one last thing I would like to say is, as you know, not only using the force we have, as a commissioner, Your Royal Highness, you know, there is a shortage of 18 million workforce, and 50% of it, 9 million nurses. We have to be aggressive on training more nurses too, in order to meet the deficit that we have. And I look forward to continue to work with ICN and also with the member states to make sure that we achieve the UHCs by having the Nursing Now campaign a success. And I will repeat, it's a daily thing to do, a daily business for us. This launching is just the beginning. Thank you.
Thank you. Thank you very much, Dr. Tedros. Can we give up our panelists a hand, please? I think if you are not inspired, you'll never will. So let's give them a hand. I will. The great part that we got here is no universal health care coverage and no delivery of primary health care to communities and families without involvement of nurses. And also that this launch is not a one-day event. Sir, Lord Nigel Crisp and I will be in your office soon enough. So expect us. So this brings an end to the launch here in Geneva. I don't know if London, you are ready to take over so that we see your lovely faces.
Thank you very much, Sheila Clow, and your distinguished panel of speakers there. That was fantastic, and what enthusiasm we have had from you all. So thank you, Geneva, and goodbye for now. Thank you.
All right. Thank you very much.
I'm going to move us swiftly on into our next speaker panel. You see, it's like musical chairs here. If you turn around, one disappears. But I'm going to welcome up Baroness Mary Watkins of Tavistock, who is our alternate chair, up to here, and she'll bring with her her panel of speakers and introduce them. Thank you.
Thank you very much, Catherine. Do come up, my three distinguished guests. We've decided that we will introduce our guests as they speak, rather than we go through the panel beforehand. But it is a real pleasure to have people from around the world here to talk to us in this historical building in terms of nursing. Many people will have already seen the Florence Nightingale statue downstairs, and outside I urge you to look at that of Mary Seacole on your way out, who is also a very distinguished nurse who has been honoured with what I think is a fantastic statue outside. And I'm speaking, I know, across the world, and saying to all of you, when you come to the huge conference in 2020 to celebrate the 3 years of our campaign, we will assure you that you will be able to come and see those two statues in person as well. I'd now like to hand over to our first speaker, who you have already heard a huge amount about, Elizabeth Ero, the chief nurse for the World Health Organization, who is an exciting, committed individual, but I also know she wants me to acknowledge Dr. Tedros's enthusiasm for a swift appointment that was in his manifesto and achieved absolutely on time. Over to you, Elizabeth.
Mary, thank you very much. First of all, let me say how excited I am to be here today and be a part of this global initiative for nurses. Having worked for much of my career as a nurse and a midwife, I am very much aware of the challenges that nurses and midwives face on a daily basis. As Dr. Tedros has mentioned, the priority for the World Health Organization is, in the coming years, is universal health coverage. This means that everyone, everywhere, can access quality health care they need without any financial hardship. But universal health coverage can only be achieved with a competent, well-trained, motivated workforce of nurses and midwives in sufficient numbers. They are central to a well-functioning health team and often the first, and in some instances, the only health professional that people see. So they need to be able to provide quality care based on the latest evidence. They need opportunities for education and career-long professional development that enables them to keep up with the constantly evolving nursing practices. And also the changes in the disease burden patterns. For example, the increasing burden of non-communicable diseases like diabetes, cancer, heart diseases, and complex care required as a result of people living longer. Indeed, studies in several countries have shown that when nurses receive quality education, are appropriately compensated, and are given greater scope to extend their roles, they deliver impressive results for their patients. So governments and academic institutions need to make sure that the nursing and midwifery workforce is well trained and supported by competent educators so they are able to provide the best quality of care. Government also have responsibility for ensuring good work conditions and an acceptable level of pay for the work nurses and midwives do. To sum up, we need a strong nursing and midwifery workforce so that anyone seeking health care can be totally confident that the care they receive is to the highest standards. At the same time, we need nurses and midwives who are competent, motivated, and are happy to go to work every day. Thank you very much.
It's now my pleasure to introduce Annette Kennedy, who is president of the International Council of Nurses, which we have already heard from Geneva, is a key international structure that enables nurses to join together as a family to advance practice. Over to you, Annette.
I think today is a great day for nursing and midwifery. Today I feel as if we've won the lotto. We can start a new era. And particularly when Minister Baldwin said she would give us more money. I think that's a real start. So I'm delighted as president of ICN to partner with Nursing Now, because I think for the first time in the profession of nursing, we see people from outside the profession actually supporting the work of nurses, encouraging nurses, seeing that they have a value in contributing to healthcare. They see that healthcare cannot and won't survive without nursing and midwifery. Health is a human right. That's what ICN believes, and that's what we all should believe. And as a human right, we need to keep it healthy, we need to keep people working, and they contribute to the economy. So investing in healthcare and investing in the nursing workforce is investing in the economy. Today, as you already heard, we launched this book. I would encourage you all to read it. It's also on the website. It's many, many case histories of where nurses are making a difference throughout the whole world, getting into areas where they're in health promotion, health prevention, tertiary care, elderly care, but with new models of care, and models of care that work and are cost effective, and models of care that contribute to the economy. And we should make the most of this. Where these are working successfully in small areas, they need to be rolled out into other areas. That's what we're trying to do. That's why we're so excited about the Nursing Now campaign, and that's why ICN is being part of it. The other thing I would like to say, and I would call on our health professionals, our politicians, our policymakers, and the community at large to support nurses in being at the policy table. Because as you have heard, we're 50% of the population of the healthcare, but we deliver 90% of the care. Now, how can you have or deliver a health service or be at policy tables without having the people that deliver it there? So I'm asking you to support that. I'm also asking for the general community, all of you out there, to support nurses, because at some time in your life, you will need the service, the care of a nurse or a midwife, at some time in your life. So maybe you don't need it now, but maybe you need it in the future. So please, please support nurses. Thank you, and thank you to Dr. Tedros, and let me say that ICN will be in his door too.
Thank you very much, Annette. And it's now my pleasure to introduce Diana Atwini, who is the Permanent Secretary and Minister of Health for Uganda. Thank you.
First of all, I want to thank the organizers of this campaign. We have come a long way. We've been talking about this. We've been looking forward to this day. And I want to thank all the countries that have been involved in this campaign. To us, this campaign marks the beginning of raising the standards, raising the profile of the nurses. First of all, I want to thank and join me to clap for the nurses, our unsung heroes that are always behind the scenes to save their lives. Me as a clinician, as a specialist, my work would be just to prescribe and examine a patient, and the rest, I leave it to the nurse. Now, the quality, the outcome of the nurses, the output of the nurses determine the outcome of the patient. And to us, that is something that we take for granted as clinicians. And I believe in this room, if we have doctors in this room, we'll know exactly what I'm talking about. The nurses stay long hours at work. We are not talking about only the quality of the outcome, but the relationship, the special relationship that nurses develop with the patients. For us in developing countries, where the disease burden is so high, where we have understaffing, where we have so many challenges that possibly the developed world will not look at, the nurses do a lot. In Uganda, 72% of the workforce in our nation is nurses and midwives. And they bear the biggest burden. They bear the biggest energy and output for our health care. And yet, when it comes to reward, they are not rewarded in the same measure. And the reason why I'm here as a policymaker, as an accounting officer of the Ministry of Health, I am here to say that I'm here to support nursing. And I am going to go all the way at policy level to come up with the policies that elevate the nurses. We want to hear the voices of these unsung heroes that not only just are confined at the bedside and taking care of the sick patients, but to sit in the boardroom and raise the voice and increase their output. We want the world to appreciate the nursing care. Because, for example, in Uganda, over 2,000 health units in the communities are managed and wholly run by the nurses. They are the front runners, they are the foot soldiers. To me, a nurse is a cement to a builder. I equate a nurse as a software to a programmer. I want to say that a nurse, to me, is the fulcrum, is the engine of the healthcare. So we cannot completely talk about healthcare and we do not bring the nurses right at the center of the healthcare. And I want to thank the nurses because they don't, their voices always is just last. They don't come out to speak because they are very busy. They are busy working. And the rest are presented. We are the ones who speak on their behalf. And this has to change. We want to see the voice of the nurses. We want to see them come up with the policies that elevate the status, put them at a higher level. Even when we increase the education level in the training, the degrees and the PhDs, that's not enough. We want more representation to see the nurses take decisions of what affects the healthcare. The nursing care in our nation, we have seen even people risk their lives. In our nation or in developing countries, we see the nurses. For example, recently when we had Ebola in West Africa, we lost many nurses. They risked their lives. But who has appreciated that? They put their lives at the line. They sacrifice. Even when they have families, they go beyond the sacrifice. And who really appreciates that? So we want really to bring out the best in the nurses, in the nursing care. And we believe that it is high time now that, as Dr. Tedros said, this is not a process, a day event, but a process. Thank you very much.
Thank you very much. I'm particularly reflective on Diane's point about nursing not necessarily being seen as an exciting and well-paid and career-orientated profession. And I think it is our job to change that across the world where that is so. I have to tell you, when I decided to do my mental health nurse training when I was 22, both my parents were a bit devastated. They had coped with me being a general nurse, but thought that mental health nursing would be a step too far. I have been a nurse now for 45 years, and before my parents died, they realized that I'd got a career. So can we all remember that? And we've had in our speeches some real emphasis from Elizabeth on the need for quality training and CPD, continued professional development for nurses. And it's now my pleasure to say we are delighted and honoured to be joined by Her Royal Highness, the Duchess of Cambridge, our royal patron, who will listen to the conclusion of the panel session and then watch a short video before joining us on stage. So to just go back, the investment in continued professional development is vital if nurses are to be allowed to work to the highest level of their profession. We've seen, for example, the success of nurse prescribing in this country. Annette reminded us that investing in nursing is in fact investing in the economy through developing women in higher education and ensuring that they give back to their communities and promote health and well-being, including, of course, mental health well-being as well as physical health well-being. Diana has talked about the need for more nurses to take a strategic lead in policy and health promotion and reminded us that we have a duty to ensure that happens, but that also we have lots of people that will help us in terms of general managers, politicians, and doctors who want to see the best for their communities and know that that will only be achieved in terms of universal health for all if nurses are further developed and allowed to practice at the right level. This will, of course, require safe regulation for quality practice, because at the center of everything we all do is the safety of our patients and to deliver care in a compassionate and holistic manner. Thank you very much indeed, everybody, for listening. Short video. It is my pleasure, on behalf of Nursing Now, to welcome our new royal patron, Her Royal Highness the Duchess of Cambridge, to speak.
Thank you so much. First of all, I'd like to say how pleased and honoured I am to be here today at St Thomas's Hospital to launch Nursing Now to help promote the vital work of nurses around the world. This campaign means a lot to me personally. My great-grandmother and grandmother were both volunteer nurses. They would have learnt firsthand from working with the voluntary aid detachment and the Red Cross about the care and compassion that sometimes only nurses can provide. Decades on, nursing has come a long way and continues to play a significant role in all our lives. From what I've seen from visits to hospices and hospitals across the country, nurses are always there. You care for us from the earliest years. You look after us in our happiest and saddest times. And for many, you look after us and our families at the end of our lives. Your dedication and professionalism are awe-inspiring. I have been struck today by the enormous range of responsibilities that nurses have, not only in providing access to healthcare, but also in terms of providing a holistic approach to caring for our physical and mental health. You also promote good health and disease prevention. In some parts of the world, nurses are perhaps the only qualified healthcare professionals in their communities, so your work is all the more vital. Sadly, however, many people still don't have access to regular healthcare, and it's in this context that a global campaign to raise the profile and status of nursing worldwide is so important. I was surprised to learn that to keep pace with the rising global demand, the world will need an additional 9 million nurses by 2030. In simple terms, that's about 2,000 more nurses every day for the next 12 years. This shows that we must act now to support and develop nurses with the skills and talent to cope with the future global health needs. Nursing Now is a call to raise the profile of nursing internationally and to help grow the profession further so it can play a key role in meeting real health challenges across the world. Finally, I'd like to congratulate and thank all nurses everywhere on what you achieve on a daily basis. The difference you make should not go unrecognised. I'd also like to acknowledge the International Council of Nurses, the World Health Organization, and the Burdett Trust for Nursing, who are playing key roles in ensuring the future of the profession. I'm most grateful for you asking me here today to support the launch of this exciting new campaign. I do hope its work will go on to inspire the next generation of nurses for years to come. Good luck to you all.
Thank you very much. If I could just ask people to be patient just while we have a couple of photographs taken, and of course you're free to take photographs too. Thank you. Yes, well, that would be lovely. Thank you very much indeed. This is Elizabeth Eero, Annette Kennedy. Yes, fine. Thank you. Thank you very much indeed.
Thank you very much.
Thank you. Yes. No, we're waiting. Just remains for me to thank so many of you that have come so far for today. I do hope that you feel invigorated by what you've heard, and that you will remember Dr. Tedros's words, which are, it's every day, not once a year, and this is the beginning of a daily reminder about the value of nursing for the next 3 years, and by then it'll just be automatic, so we'll do it for life. And I think in a moment the doors are going to be opened. I'm just waiting to see, because we have to just give a short time for the Duchess to leave. Sarah, I'm waiting just to see if Sarah says we can leave yet. Just a moment. Thank you. Thank you. Thank you very much indeed, everybody. You're free to go. Thank you.